Well, dry eye disease is actually a very common condition, and it occurs when your tears aren't providing enough lubrication for your ocular surface. And this may be because your eyes aren't producing enough tears, but most often it is because the quality of the tears you're producing is poor. So it's a quality problem rather than a quantity problem. So the symptoms are gritty feeling, a feeling that the sensation that there's something in your eye, a foreign body in your eye, a grain of sand. Some people complain about tired eyes. Their eyes want to close in the evening when they're watching television. They're not tired themselves, but their eyes feel tired. And dry eyes can also be red eyes. And dry eye problems can also lead to blurry and fluctuating vision, so that patients describe that their visual acuity is not always the same, it's not always good. And typically the eyes are okay in the morning, but then as the day advances, because the tears evaporate, the feeling of dryness becomes more pronounced, making it more difficult in the evening, for example, to read a book or to watch television. And when you ask patients about this, they will typically describe this. So in the morning, they've slept, the eyes have been closed, they're okay, but then in the course of the day, the problems of discomfort get more important. And for many, it's indeed a problem of discomfort, but some patients with more severe problems, then the problems can be so bad that they have pain and that it's even hard to open their eyes. And these patients, when they come in, either they blink a lot or they just keep their eyes closed while you're talking to them. And in these severe cases, the eyes are susceptible to infection, and this can lead to scarring of the cornea and to loss of vision. So in most patients, it's about discomfort, but in a subgroup of patients, it's a very severe, debilitating disease. And for treatment, well, the problem is we don't have a cure. Fortunately, we have eye drops, and we can use these to alleviate the symptoms of the disease. Most of the time, we use artificial tears, which are actually not medical drops, but lubricants to lubricate the eye surface. And it's important to know for patients that the disease will go through bad and better periods, and that they have to manage the disease themselves. And that when their eyes feel bad, they should put drops in at least 3 to 4 times a day. 1 drop a day won't help you very much. So they have to put in enough drops. And when the dry eye problems are better, they can decrease the number of drops. But for most patients, the message is that they have a chronic disease and they have to live with this and manage their disease. And fortunately for many, the artificial tears are enough to alleviate the symptoms. So many people are at risk of developing dry eye symptoms, dry eye disease. About a third, as I've already mentioned, is at risk. When we get older, we produce less tears. And you don't need to be an old person to have dry eye problems. Even young people can suffer from dry eye problems. Let's think, for example, about the age group between 20 to 40 years of age. Many people in this age group prefer to wear contact lenses rather than spectacles. But then they notice that if they wear contact lenses, that at the end of the day, they have these dry eye symptoms. That their eyes are starting to feel this grittiness and that they need to remove the contact lenses. And they ask me, why don't I have this problem in the weekend? And in the weekend, they're not behind the computer all the time. As a woman, you're at risk even more because hormonal changes. If you're pregnant, pregnancy, at certain moments, your hormones go back to normal and your dry eye problem can disappear again. But when you go through menopause, then the hormonal changes are permanent. And then you can have even worse dry eyes than the men typically have. And what we all get when we're getting older, that's cataract. And if we undergo cataract surgery when we're 70 or 75 years old, we know now this is something that was much neglected in the past, that if you undergo cataract surgery, that after the cataract surgery, you risk having dry eyes for quite some time, for several weeks or even months after the surgery. Continuing about risk factors, there's this subgroup of patients, and then I'm thinking about autoimmune diseases, and the nicest example of autoimmune disease leading to dry eyes is rheumatoid arthritis, systemic disease, meaning it can attack all kinds of tissues in your whole body. And rheumatoid arthritis is well known that it can also lead to your immune system attacking your lacrimal glands and your salivary glands and leading to very severe dry eye and dry mouth problems. But there are a lot of medications that as side effects can aggravate dry eyes. So I hope that with my answer, I've drawn a picture of the broad range of people in the general public that can have problems with dry eyes. Yes, we've seen a major impact of COVID on dry eye disease. There's two reasons. On the one hand, people are spending so much time on their computers. Take their online courses, people are working at home. When you're focused on your computer screen, it's normal that you blink less. And then there's more time for the tears to evaporate. People have asked me, is computer use bad for eyes? And I tell them, well, actually, it's not the computer. It's the fact that you're focusing at a short distance, but you do the same thing when you read a book, you're staring. When you're talking to somebody, I'm much more lively, so I blink a lot more. And if I blink, there's less time for evaporation. I spread the tears over my ocular surface. So we hear from patients and we hear from students that they develop new symptoms of dry eye disease, or if they've had dry eyes, that these symptoms are more pronounced now. There have been reports in the literature about the increase in the dry eye complaints when people are wearing masks. If your mask doesn't fit tightly over your nose, and if you breathe in a mask, then most of the time the air is escaping at the top of your mask, and there's an airflow over your ocular surface. More airflow over your ocular surface, so there's more evaporation. Well, you should take care in the morning that you adjust your mask well. If there's a wire in the mask, then you can adjust this to fit your nose snugly, or you can tape the mask at the top so that the air doesn't escape at the top, but escapes in other directions. Don't forget to give your eyes a break regularly. If you can take off your mask, if you can stop working at the computer after 20 to 30 minutes and just look away from the computer screen, look through the window, give your eyes a break, blink a few times, close your eyes as I'm doing now, stretch your muscles, relax a little bit, and then go back to work at your computer. I guess that's the most important thing we can do to keep healthy the eyes and the muscles, and continue working online for, unfortunately, probably still a few more weeks or months. Well, you can help us a lot, and then I'm saying us as clinicians a lot on two fronts. First of all, of course, in diagnosis of patients. You would say, well, it's pretty straightforward, the diagnosis of dry eye patients. They complain about the grittiness, the feeling of sand, the tiredness, and we don't see other diseases. Then we can say, yeah, well, probably you have dry eye. And actually, that's a lot how it works. We still lack a lot of good objective tests to determine that somebody has dry eye, and for example, not allergy. So for a specific patient, for an individual patient, we still need much better diagnostics. We have many treatments at this moment, but as a clinician, it's still very difficult to determine what will be beneficial for a specific patient. And so often it takes a lot of patience to find out the optimal treatment in order to help the patients. But in many cases, you feel frustrated because you cannot always help them well. You have to tell them, you have to live with this disease. And if we can find a treatment scheme that helps you, well, all the better, but stick to the rules, learn to manage your disease. And well, of course, we're hoping, as a clinician, I'm hoping that the research will lead to a silver bullet, that there will be this eye drop that will help all these patients straight away. Not curing them, because finding a cure will be so difficult. All these dry eye patients, they're so diverse. But I am hoping that the collaboration between all these centers, and especially, well, I'm a clinician, but I can play only a little role. I need you as a group of basic researchers to work in the lab, and to find these compounds that will become pharmaceutical products. I need you to do the testing in an animal model. I need you to not only develop a very promising molecule in the lab, but to bring this to the pharmacy where so that I can prescribe this medication and people can just go to the pharmacy and buy it. So I think this project is a wonderful collaboration with people working in the labs, but also researchers who have the know-how to bring the work that's done in the lab to what we call the bedside, but for dry eye patients, they're not in a bed. So to bring it to the pharmacy where patients can go with my prescription and buy this product.